Assalamu alaikum everybody. This is the second presentation about diuretics in continuation of our last presentation, and in this presentation inshallah we'll talk about osmotic and loop diuretics. I have to remind you that revision of the previous presentation is necessary to understand the mechanisms and site of action of osmotic and loop diuretics. The second group, which are osmotic diuretics, and osmotic diuretics, we said they act at the proximal tubule, and they act as well at the collecting ducts, Osmotic, from their name, they are osmotic diuretics. Most famous example is mannitol. Mannitol, usually it is an inert. It is highly polar. Once it is given, it's not absorbed, it's not metabolized. It will stay in the physiological fluid where it is. It cannot cross the biological membrane because it is an inert. It is highly polar, cannot cross biological membrane. It will stay in the biological fluid where it is given. So if it is given by intravenous injection, they will stay in blood. It will stay in plasma. This will increase the osmolarity of extracellular spaces. By increasing the osmolarity of extracellular space, that means extracting the intracellular water. The water will exit from inside the cell to the spaces between the cells. This will produce what's known as edema. Edema is expansion of the extracellular volume. Of course, this is dangerous where the person is suffering from edema, like in cases of pulmonary edema. Okay, so these drugs, when they are given intravenously, they increase the osmotic pressure of the extracellular space. This will result in removing water from inside the cell to the extracellular space, and this will result in tissue edema. This is dangerous. These drugs usually, when they are given intravenously, they are excreted by filtration, by glomerulus filtration. They are not, as we said, they are not reabsorbed. They are not absorbed or reabsorbed. So once they are given intravenously very fast, they will be filtrated through the glomerular filtration process. Okay. Once inside the kidney, once inside the urinary filtrate, they increase the osmolarity and the urinary filtrate throughout the nephron, whether it is proximal or distal tubules. And this increases osmolarity. That means it will prevent reabsorption of water, and this will result in water diuresis. Okay? So these drugs, when they are excreted through glomerular filtration through the kidney. Once they are excreted in the urinary filtrate, they increase the osmolarity of the urinary filtrate, preventing the reabsorption of water through different parts of the nephron, and this will produce what's known as water diuresis. This is applied clinically in certain cases of renal failure or anuria. In certain cases of anuria, some people, sometimes their kidney function is not well. They do not produce enough urine. So in this case, they are given mannitol intravenously, but to increase the urine outflow and urine volume. This is one application. The second application, they are used to decrease the intraocular pressure in cases of glaucoma. So they will decrease the intraocular pressure, and therefore they are used in treatment of glaucoma, especially before surgery, before surgical operation, to decrease the intraocular pressure before surgical operation. Okay. The same thing, they will increase the intracranial pressure, or they are used in certain neurological condition. Okay. So mannitol, by reducing water diuresis, is used in condition related to the kidney, and to the eye and to the cerebrospinal fluid. Of course, because they produce severe diuresis, they can cause dehydration. They can cause dehydration. In this case, this can be prevented. The dehydration can be prevented by giving water replacement, of course, intravenous saline usually. Okay, so this is the second diuretic, osmotic diuretics. They are used usually intravenously. Of course, if they are taken orally, they produce diarrhea. They produce diarrhea, but they are not given for this reason. But if they are given intravenously, they can produce water diuresis, very strong water diuresis, which has many clinical application. Okay? So this is the second group. Third group we are going to talk about are very important diuretics, which are known as loop diuretics. Loop diuretics. They are known loop diuretics because they act at the thick ascending loop of Henle, as we will see. So they are known as loop diuretics. And also they are known as high ceiling diuretics. High ceiling diuretics. Why high ceiling diuretics? Because they produce the maximum possible diuresis. Their efficacy is very high. They produce the maximum possible diuresis. Okay, this includes two groups of drugs. One which are sulfonamides in structure. They are sulfonamides. They belong to the sulfa group of drugs, sulfonamides, and this includes the furosemide, bumetanide, turisamide, and turisamide. Okay, so these are sulfonamides. Sulfonamides, that means they can produce allergic reaction to certain people who are allergic to sulfa drugs. The second, they are non-sulfonamides and includes very famous example, ethacrynic acid. Ethacrynic acid. So if somebody asks you, what's the difference between ethacrynic acid and furosemide? The only difference in structure. Furosemide is sulfonamide, can subject a person to allergic reaction, while ethacrynic acid is not a sulfonamide and it does not produce allergic reaction. So loop diuretics usually, they are quickly, when they are taken orally, they are quickly absorbed and quickly excreted into the kidney by filtration and tubular excretion. So loop diuretics, when they are taken, kinetically, they are absorbed very fast and they excreted fast as well through the renal excretion. Of course, if they are given intravenously, they will be immediately excreted in through the kidney by filtration, glomerular filtration, and tubular excretion. In tubular excretion, they use the acid excretion sites. They use the acid excretion sites. Therefore, they will compete with weak acids on the excretion sites. Weak acids like what? Like non-steroidal anti-inflammatory drugs, which is aspirin, like aspirin. If aspirin is taken with furosemide, they will compete on the tubular excretion because both of them, they are excreted by the same mechanism, which is the weak acids mechanism. Okay, في الحالة هذه as well it happens with uric acid. Uric acid as well is excreted by uric acid by the weak acid excretion site. So as well, furosemide and ethacrynic acid will compete with uric acid on its excretion site and prevent its excretion. Some people will tell you that aspirin will decrease the effect of loop diuretics. Give a reason. Why? Why? Because aspirin-like drugs, aspirin معروف الاسبرين هذا بتاع الصداع. Aspirin-like drugs, most famous, aspirin. So what will happen, aspirin, if it is taken with loop diuretics, it can decrease the diuresis produced by loop diuretics. Why? Because it will prevent its tubular secretion, because they have to be secreted first to produce an action. Okay? So we expect that These drugs will produce drug-drug interaction with non-steroidal anti-inflammatory drugs like aspirin and with uric acid. So how these drugs act? These drugs, they act on the thick ascending loop of Henle. As we have described before, there is the thin descending loop of Henle, then there is the thin ascending loop of Henle, and the thick ascending loop of Henle. So they work on the thick ascending loop of Henle. What they do, in the thick ascending loop of Henle, there is a specific co-transporter known as co-transporter. This co-transporter is a protein which is present in the luminal side of the epithelial cells of the thick ascending loop of Henle. So, subhanallah, khaliq. So this co-transporter is specific in transporting sodium ions, potassium, and chloride from the urinary filtrate into the epithelial cell. Okay, this is co-transport without using energy, of course. There is a co-transporter which transport sodium, potassium, and chloride from the urinary filtrate into the epithelial cell of the thick ascending limb of Henle. So what will happen next? Potassium and chloride will be transported through the basolateral membrane into the general circulation by another co-transporter known as potassium chloride co-transporter. This is specific for transporting potassium and chloride from inside the cell to the general circulation, co-transporter. Okay? So what will happen to the sodium? Sodium will be exchanged with potassium. Sodium will be removed from the intracellular space into the general circulation by the sodium-potassium pump. Sodium-potassium pump or sodium-potassium ATPase. Okay? So what will happen? Sodium, potassium, and chloride, they are transported into the cell, and then they are transported either passively through a specific transporter for potassium and chloride, or actively through sodium-potassium ATPase for sodium. Okay? Now, potassium will leak into the potassium ions, which is secreted, will leak into the urinary filtrate, will leak into, subhanallah, look at this. Please concentrate on this. This is very, very interesting. Potassium will leak into the urinary filtrate, and as potassium is positively charged, it will create a positivity on the luminal side of the membrane. It will create a positivity on the luminal side of the membrane. This positivity, which is known as positive electrical potential, this will drive divalent cations like in magnesium and calcium cations ويحصل لهم reabsorption through the cells, through the spaces between the epithelial cells. Okay? So absorption of calcium and magnesium takes place in the thick ascending lobe of Henle by the mechanisms we have said. So in this case, in the thick ascending limb of Henle, absorption of sodium, potassium, chloride, magnesium, and calcium will take place. Okay? So now, if we inhibit this co-transporter, if we inhibit the sodium, potassium, chloride co-transporter, that means the absorption of these ions will not happen. So they will not be absorbed. And as well, potassium will not leak into the urinary filtrate, and the positive potential will lose. So calcium and magnesium will not be reabsorbed. This is what happens with loop diuretics. With loop diuretics, if the loop diuretics, they will inhibit the luminal sodium potassium chloride transporter. So what will happen in this case? They will increase the excretion of this electrolyte, of course with water, and this will produce strong diuresis, very strong diuresis, very strong diuresis. That's why they are known as high ceiling diuretics. They are known as high ceiling diuretics. So in this case, they are applied clinically in certain edematous conditions. In certain edematous conditions like acute pulmonary edema, because they will increase the diuresis, معناها decrease the blood volume, they will lead to decrease tissue edema. So they are used in edematous condition like acute pulmonary edema, which results usually in the acute heart failure or congestive heart failure. And in this case, usually they are given parenterally by intravenous administration. Okay. The second use, they are used in acute renal failure, because they produce strong diuresis and therefore they are very effective in acute renal failure. In treatment of hypertension, they have little use in treatment of hypertension. Why? Because they produce very high diuresis. Okay. Second, they will increase the excretion of potassium because they inhibit reabsorption of potassium. They increase the excretion of potassium, and this is why they are used in certain cases of mild hyperkalemia. In mild hyperkalemia, some people they suffer from mild hyperkalemia, high potassium level in the blood. This is dangerous because hyperkalemia can result in different kinds of cardiac arrhythmia, disturbance of the rhythm of the heart, hyperkalemia. So in this case, they give thiazide diuretics, and usually thiazide diuretics in this case they are given with saline, sodium chloride, and water to prevent the hyponatremia. They give saline, and to prevent the dehydration, which can result, they give water. So they increase the excretion of potassium, and that's why they are indicated in certain types of mild hyperkalemia. And in this case, usually they are given with saline which contains sodium chloride to prevent hyponatremia, which can take place in the body, and as well saline will provide water to prevent dehydration. Okay, this is the second physiological function and clinical application. Third, they increase the excretion of calcium, as we have said, because we have said the calcium absorption will depend on the positive electrical potential of the luminal membrane. If there is no positive electrical potential, calcium cannot be absorbed, it will be excreted. Therefore, loop diuretics, they increase the excretion of calcium. That's why they are applied in certain types of hypercalcemia. As we will see later when we talk about the endocrine system, hypercalcemia can take place at different tissues in the body and can produce different disorders. So in this case, loop diuretics, they will increase the excretion of calcium, and therefore they are used in treatment of certain types of hypercalcemia. Okay. Last thing we talk about are their side effects. They increase excretion of potassium, so we expect they will produce hypokalemia. Hypokalemia, that means decrease in level of potassium in the blood. They produce hypokalemia. This is very famous. Okay. Usually when they increase the potassium excretion, they will increase with it the proton or hydrogen ion excretion. Hydrogen ion excretion, as we will see later, when we talk about the collecting tubules, increasing the proton secretion will increase the pH of the blood. Increasing proton or hydrogen ion secretion will increase the pH of the blood. This will result in metabolic alkalosis. This will result in metabolic alkalosis. Okay, so these drugs, as side effects, we have to take care of is hypokalemia. They can decrease the potassium level in the blood, and they can produce metabolic alkalosis, i.e., increase the pH of the blood. Okay. Usually, sulfonamides they affect the optic nerve, and they can lead to hearing loss. So sulfonamides in general, they can produce an effect on the optic nerve, and they can lead to hearing loss. So usually these drugs they produce reversible dose relating hearing loss. The higher the dose, the more the chance of hearing loss, and vice versa. As we have said, they are excreted through the acid secretion sites, and therefore they will prevent the excretion of uric acid. This will result in hyperuricemia. Hyperuricemia. Hyperuricemia means increase in the level of uric acid in the blood. Usually, this happens in people who are suffering from gout. So, hyperuricemia, people who are suffering from gout should not be given loop diuretics because they will make their hyperuricemia worse. Okay. Lastly, these sulfonamides, especially sulfurosemide, bumetanide, and so these sulfonamides, some people they are allergic to sulfonamides, especially sulfonamides, including antibiotic sulfonamides. They are allergic to sulfonamides. They will suffer from different types of allergic reaction, and they might even enter into allergic anaphylactic shock. So in this case, they can produce different allergic reactions, including skin rash, including angioedema, and in this case, these drugs they are contraindicated. Okay. So this is the third group, which are the loop diuretics or the high ceiling diuretics. So in summary, we can say osmotic diuretics, on the other hand, they increase osmolarity of the urine in the proximal and distal tubules, and they produce water diuresis. That's why they are used in anuria, and they are used in treatment of glaucoma, especially before surgery, and also they are used to decrease intracranial pressure in certain neurological conditions. A third group, loop diuretics, we call them high ceiling because they produce loop diuretics like furosemide. They produce high ceiling, call them high ceiling because they produce the maximum possible diuresis, and they are used in certain edematous conditions like in pulmonary edema, and as well in certain acute renal failure, and they are applied in certain types of hypercalcemia and hyperkalemia. I would like to thank you very much for your attention. Please don't forget to subscribe to my channel. I wish you good luck. I wish you happy Ramadan and happy Eid Fitr Mubarak عليكم جميعا.